Good afternoon, everyone, and happy International Women's Day. Today, we celebrate the achievements of women and girls around the globe, and we could recognize one of our own, recognized just the other day at the YWCA Women of Distinction Healthcare Hero Awards for Hamilton, our very own Dr. Elizabeth Richardson. So congratulations, Doctor. I think I can speak on behalf of the community when I say thank you for your leadership and your steadfast commitment in helping us navigate through this pandemic. So kudos on you and well-deserved congratulations to you for sure. Tonight, we will also light the Hamilton signature sign purple and gray to celebrate the International Women's Day and bring further awareness to the inequality women and girls face every day. On a more somber note, this week also marks the 1-year anniversary of our community's first positive COVID-19 case on March the 11th. And as you may have heard earlier today, the Government of Canada is designating the same day, March the 11th, 2021, as a national day of observance to commemorate the people who lost their lives and the significant impacts we have all felt because of COVID-19. So we will be honoring those we lost to the virus and who have been seriously affected by lowering the Canadian flags at City Hall of Hamilton for the entire week, beginning this Thursday. Our hearts and deepest condolences go out to the family and friends who've lost a friend or a loved one to COVID-19. The virus is still very active in our community, and we must continue to follow those public health and safety measures to keep everyone safe. Lastly, I would say that the Government of Ontario is providing additional support to businesses that are required to close or significantly restrict services under the provincial shutdown, or for regions still impacted by red control or gray lockdown restrictions. This grant provides businesses with $10,000 to $20,000 to help cover decreased revenue as a result of the mandated shutdowns. The application deadline for this grant is March the 31st. So visit ontario.ca for more information under the COVID-19 Business Support Grants page. And on that note, I'm going to turn it over to our Emergency Operations Director, Paul Johnson.
Well, thanks very much, Mr. Mayor. And I want to congratulate as well Elizabeth on her award the other evening. And, Elizabeth and I have worked together for years and years and years, and it's great to see her receive that award. She's also part of our leadership team. My other job, when not the EOC director, is the general manager of Healthy and Safe Communities, a department at the City of Hamilton. And I'm really pleased that not only Dr. Richardson is part of our leadership team, but we have 50-50 gender parity on our leadership team. And that brings a conversation and voices to the table that's really important. And we are working hard in our department, and I know we're working hard across the city to do our part to respond to the continued inequity. And this pandemic has only highlighted further the work that we have to do. So congratulations, Elizabeth, and your words the other night were very well placed given what we're dealing with in this pandemic and what we will have to deal with coming out of this pandemic. From an EOC perspective, some city services are beginning to open in recreation, as we talked about. So there will be some additional openings of city pools for, again, limited engagement by residents of the community. Our numbers are greatly reduced, but it again gives another recreation opportunity done in a safe manner in our community. So please do check our website for when those pools come online, and it gives another outlet. I know there's a great lane swimming community here in Hamilton, and really want to encourage people to engage in various forms of activity. And it is nice to look at the weather, at least for a couple of days this week, and see some very nice temperatures, which will also help encourage us to be outdoors when we can as well. Enforcement continues to be a priority at the City of Hamilton. And I would say at a general level, from an enforcement perspective, we are seeing more and more calls for responses to private parties on occasion. And you'll see on our website this week that on occasion those happen through business ventures, and Party Villa is one of those types of activities. It's a kind of short-term rental piece. I won't call it by other names because it's not a branded a rental piece, but it acts in the same way that some of those other short-term rental establishments act, and it has been the host of gatherings that include too many people. But this is also happening in private residences. and those don't show up on our website, but I can tell you that hearing from our bylaw enforcement officers, it is becoming more of the calls that they're going out to, and that's disappointing, because we do need to realize that while there's been a slight loosening of the restrictions, we're not under the stay-at-home order, for instance, anymore, that the red control category is really about controlling the spread, because there are still high numbers of outbreaks and high levels of cases, and Dr. Richardson will take us through that. But speaking just for some of the services that we manage as a city, like our emergency shelter system, we still have outbreaks everywhere. And although we've started to vaccinate those who are in our homeless shelter system, we're dealing with the crisis still of the continued march of this virus through certain places. So do your part, please, and keep those gatherings to the acceptable limit if you feel you have to gather together. And the best course of action, of course, is to stay just with your household for a little while longer while we work our way through these. I did want to also piggyback on what the mayor said, and this Friday is going to mark 1 year since we activated the city's Emergency Operations Center. Elizabeth had her team and from a public health perspective activated before that, but the Emergency Operations Center started on March the 12th. And so it has been a long year of working through the many issues that we've needed to work through as a city, and it's incredibly challenging for everyone. I did want to take this moment to thank the city staff who have been supporting this effort for almost a year now, and will continue to support it as we move through the next number of months. This isn't an anniversary to mark the end of something, it's an anniversary to remind us just how long and hard this crisis has been. And so for the 8,000 individuals at the city of Hamilton who come to work every day and are listening to what we need to do as a city in order to continue to deliver essential and critical services, but also respond to this pandemic by doing the things that can help support our community to be healthy and safe. I just want to say a big word of thanks to all of those who have done so. I do want to announce that we will be launching a video series entitled "This is COVID-19." That will, in conjunction with this year anniversary of the marking of the declaration of the global pandemic, it will introduce you to a number of people, some of whom you know, and some of whom you've not met in our community, who have been touched by COVID-19, either in terms of the virus itself and its impact on themselves or others, or the impact of this crisis to their work and to their family life. And so 17 members of our community have been interviewed, and they will share some of their stories through a series of videos that we're going to make public in the coming weeks. So we're going to share those stories once a week, but today what we thought we would do before we turn things over to Dr. Richardson for her update is just share the opening video. It's called in the business a teaser. It doesn't seem quite right for this subject matter, but our video, which launches this series, we wanted to share that short video with you now, and then more of these videos will come out over the coming weeks.
Staff, I care about my residents, our 2 City of Long-Term Care homes, and my family.
We stand together, and it starts with you.
Do this for the children.
We're all in this together, Hamilton.
Be strong.
The future needs us to do the right thing.
It's all about kindness.
Be patient. We're going to get through it as a community. We just have to do it together.
Together, we really can build a healthier and more resilient Hamilton.
The public health measures are for everyone.
We're all in this together, Hamilton.
And together, we will do this.
So they took me by wheelchair into my mom's room. I held her hand. I told her I loved her, and I told her it was okay for her to go.
And so as you can tell from that short video introduction, you will hear stories of immense pain, you'll hear stories of immense resilience, and you'll hear stories of that will inspire you about how our community has come together. And in my mind, that really is the story of this last year, and it's going to be the story as we continue to move through this pandemic. So thanks to the team for showing that video, and Dr. Richardson, over to you.
Thanks very much, Paul. And I think it's very much, as you say, it's the story of this past year. And we're going to go through and tell you where we're at today in terms of cases and vaccinations, as we hope to move forward more and more into the light, as you were, in terms of the tunnel we've been in as relates to COVID. So today we're at 10,831 cases, 30 new cases from yesterday. So we continue to see these, it's sort of small waves when it comes to the incidence of COVID-19, but we're not seeing any sort of continuing decline at this point. We're sitting at about 56 cases per 100,000 per week. We've had 125 cases now locally that are screened positive for the variant, and 4 confirmed cases of variants of confirmed concern. I just wanted to mention, when it comes to having those confirmations, because of the time that it takes and the intensity of work that it takes in order to sequence those, we're not expecting those to come through quickly. And we do know that there's just about all of the ones that screen positive turn out to be positive on confirmation. And so really are tracking that screen positive number as we go forward. 409 active cases then at this point, with 287 deaths to date, with no new deaths today, but we do continue to have outbreaks with 25 local outbreaks, which you'll see up on our website. 3 of those are new today: Sharinga Greenhouse, Supercuts in Waterdown, and Queensdale Elementary School. So as always, there's a lot more details there, but I do just want to talk for a minute about International Women's Day. As we've talked about, particularly for women and for racialized communities, they've been harder impacted by this COVID-19 pandemic, both around the world and here in Hamilton. And I just want to acknowledge and celebrate the very hard work and commitment of the women in our community. Of course, the names and professions of those who have been working so hard are too many to mention, but whether they're on the front lines as our caring professions, our personal service workers, our nurses, those that are working in shelters, those that are working on the front lines in grocery stores and pharmacies and in all those essential places, or in leadership positions here at the city or across our community. Please know your efforts and passion for the well-being and safety of our community is inspiring to all of us, and your sacrifices and hardships are not going unnoticed. I do want to speak briefly about the concerning allegations that came forward on Friday regarding potentially inappropriate vaccine distribution at our mobile vaccination clinic. As many of you know, we are currently investigating some allegations that were received on Friday, March 5th, that 3 employees working in one of our mobile vaccination clinics inappropriately administered approximately 15 COVID-19 vaccine doses to individuals who are not currently eligible to receive the vaccine. I do want to remind you that these are allegations only at this stage. We are very grateful when people feel that they can come forward and share with us our concerns, and we do take them seriously and act on them and investigate. And that investigation needs to be very respectful and thorough and timely in terms of how it is carried forward. In accordance with our standard practice, the employees are placed on paid leave and the investigation follows on from there. While we await the outcome, we have reminded our staff about their professional obligations to follow our established policies when it comes to immunizations, and particularly in regard to this COVID-19 vaccine rollout and the prioritization framework for populations who are eligible to receive the vaccines at this time. We are committed to ensuring that our vaccine rollout is fair, equitable, and based on the criteria that prioritizes those most in need. And of course, any actions that are taken to circumvent the vaccine program's eligibility criteria are of course unethical and not acceptable. So if you have any further questions about that, you can refer to our press release that was issued on Saturday, March 6th. In terms of the rollout, our pop-up clinics in a number of areas across the city and St. Joe's West 5th COVID-19 vaccine clinic continue to vaccinate community members 85 years and older. We did see, of course, the province's announcement this past Friday, which must be very encouraging for people as we roll forward and as we prepare to move into phase 2 of the COVID-19 vaccination rollout next month. We are just a few steps closer to having more vaccines for more Hamiltonians. And we're very grateful for that. Our plan, of course, is in an evergreen state based on when the vaccines are planned for and how the province is allocating the vaccines and making decisions about distribution. And we'll continue to make sure that we roll through the prioritization framework as it is as it is announced and put forward. So we are pleased to share that we will have 2 additional sites now confirmed as large-scale vaccination clinics. We'll have more to say about these, the timing, when they'll open, what their hours are, all of those sorts of things in the coming days. But just to let you know, the sites for these are First Ontario Place, as well as Rosedale Arena. And so we're working with our city staff and with others to get these set up and be ready to go as the vaccine numbers increase over the coming weeks. It's only the tip of the iceberg, I'm happy to say, in terms of what's going to come. If you look at our overall plan that's up on our website and look at what we have to roll out over the coming weeks, it will ultimately involve additional sites that occur with additional partners playing a role. And we'll continue to keep you up to date as that moves forward. The booking tool, we are very glad to say, is going to be launched by the province on Monday, March 15th. This is something we've been very much waiting for. We know how frustrating it has been for people in terms of working with the booking system that we have rolled out thus far, in terms of trying to get ahead and get what needles and arms we can over these past few weeks. But this tool will come online on March 15th. And once it's ready, we understand that as of the 3rd week of March, those 80 years or older will become eligible, those 75 years and older as of April 15th, May 1st for those who are 70 plus, and June 1st for those 65 plus, July 1st for those 60 and older. And so we'll be working with the province in terms of them rolling out the ages and dates that people can begin to register, and then working on getting vaccines into arms as quickly as we possibly can. So more details about that will continue to be on our website at the hamilton.ca COVID vaccine site. And so please do continue to stay tuned to that. So in terms of progress of where we are to date, as of yesterday, we have done a total of 46,000 vaccine doses, 12,000 of those through the mobile site, and 2,900 have been administered at St. Joe's West 5th Clinic, and almost 31,000 have been administered at the HHS Vic site clinic. Turning instead to the variants of concern one more time, just to remind people that those numbers do continue to increase, and there is significant concern that they are more transmissible than the former, the usual vaccine or virus that has been circulating. And there's concern that these will become the predominant strain over the coming weeks. Modeling that has happened and the studies that have happened around this particular virus shows that it does spread more easily, and that they have had accelerated numbers of cases and outbreaks in countries where that has happened. So the continued vigilance around following public health measures is absolutely critical as we go forward. And I'll say it again, and we've been saying it since April, about staying home if you feel unwell, getting tested if you have any symptoms or have been in close contact with somebody who's a confirmed positive case of COVID-19, limiting gatherings to members of your immediate household, maintaining that physical distance, wearing a mask indoors and anytime outdoors where you can't maintain that distancing, and washing your hands frequently. We have, of course, adopted our procedures so that we are treating all of our cases that occur now as if they might be variants of concern. And so having a higher level of restraints around how we determine contacts, all of those sorts of things are really important. So Paul and the Mayor have talked about March 11th and the importance of that day. I'm going to reach one step beyond March 11th to March 15th and St. Paddy's Day. And of course, that is a celebration that many people partake in all through our community. And I just want to remind people, as you might be thinking about St. Paddy's Day, to not gather with people who are outside of your household for celebrations, especially not so in large numbers. While you are permitted, of course, to have some small gatherings under the current red restrictions, it's not recommended. So particularly with the variants of concern that we have within our community. So please find ways to celebrate, and there are many. Raise a flag at home, have a green drink, put on the green clothes, have a good time, but please do not get together in crowded spaces or in large crowds for the St. Patrick's Day holiday. For any restaurants or bars that are welcoming patrons, please make sure that only 4 people are seated together per table and that tables are at least 2 meters apart indoors or outdoors. Do not serve people food or drinks that are not seated. Patrons cannot wander around the patio with a drink in their hand. They do need to be seated the whole time that they are there, except when they're coming and going from the washrooms or to their table, and they must be closed by 10 p.m. in Hamilton under the provincial framework. So please do enjoy the day. As with all things that we've gone through over the last year, it's important to take the time, have some fun, connect with other people, but do it in ways that are safe. Back to you, Mr. Mayor.
Thank you, Doctor. And if we do all of that, hopefully next March, we can have a great St. Patrick's Day celebration. And I'm sure that's something we'd all be looking forward to. In addition to following those public health measures, you should continue to follow them, even if you've been vaccinated. There are other ways that you can help. So you can download the COVID Alert app on your smartphones with the App Store or Google Play. Donate to a local food bank, including Hamilton Food Share or Food for Kids or the Good Shepherd, to name just a few. And if you're in good health, consider donating blood. Visit blood.ca to book an appointment at the Canadian Blood Services location in Ancaster. Shopping and eating local whenever possible is great for our, local restaurants and our local stores that are doing curbside pickup. I think that continued support through the hometowonhub.ca is going to be, very, very helpful. And, we have an amazing business community still, and they're eager to help you with online sales or curbside pickup, whatever suits you. So please do support your local businesses and do support your local neighbors as well, especially the elderly neighbors, to make sure you just check in on them, make sure they're okay, especially the single elderly folks that may have family that are out of town. Check in on them and make sure they're okay, and make sure that they also get lined up for the vaccination. Remember that our elderly is the community members that are most at risk still. Anyone else with underlying health issues still remains at risk. So these variants are problematic, and so those public health measures are still critically important. And this is not the time to let go of those public health measures, because we need to get well past this and well into vaccination before we can actually make a determination as to when we can relax and get back to some sense of normal. So please think of others, stay at home as much as possible, and help contain this spread. It is great news that we've vaccinated some 46,000 plus members in our community, and that will be accelerating over the coming weeks and months, and we certainly look forward to that. And when the vaccine becomes available to you, whether it's Pfizer, Moderna, or Johnson & Johnson, please get the vaccine. It's going to be critically important for all of us to get back to some sense of normal. So getting the vaccine is going to be a key part of herd immunity and that 75 to 80% of the community that needs to be vaccinated before we can get back to some sense of a great St. Patrick's celebration, not this year, but next year. On that note, let me just thank our broader community. We thank our great public health workers and our city staff and everyone that's been involved in getting us through this pandemic in a physical way throughout the community. But it's taken all of you doing what we are asking you to do to help us get through this with all the sacrifices that employs. So thank you so very much. And I think we'll spend a good part of the anniversary week, recognizing and celebrating the good work that you've done in our community, because without your efforts, we would have been in very, very much more dire straits. And certainly we were able to minimize the impacts, and hopefully as vaccinations start to happen, maximize some sense of normalcy. So on that note, Jasmine, I'm going to turn it back to you and ask you to lead us through the media questions.
Great, thank you, Mr. Mayor. We'll start with one question and one follow-up for everyone. First question will be to Lisa Hefner from CHCH. Lisa, you can go ahead.
I figured out how to unmute. Hello. I would just ask Dr. Richardson, congratulations, by the way, on the Woman of Distinction Award. Could you just comment, though, on the case at Able Living Services? There's only one case, but it is a variant, screen positive, and it is population, I think, of vulnerable people. So can you just comment on your concerns around that particular case?
Thanks very much, Lisa, and thanks for the congratulations. In terms of individual cases, we of course don't get into any details, but I'm sure that's not what you're looking for. Essentially, what we're doing now with any of the variants of concern is we are treating every case the same way and treating them as if they are variants of concern. So while we are concerned overall in terms of infection control and continued spread, we have been working very closely with all the partners to double down on what it is they need to do from an infection prevention and control perspective for every case, whether or not it's proven to be a variant of concern or not. So it's really more of a widespread concern that we have in terms of the ongoing number of cases in our community. And that's why it's so imperative that people continue to follow public health measures, vaccinated or not, as we continue to bring this under control. What we do know as well is that the more spread that we have, the more opportunities there are for other variants to emerge. And so another reason why it's very important to keep the case numbers down.
And Lisa, if you'd like a follow-up, you can go ahead.
I think I'm good. Thanks very much.
Okay, we'll go next to Desmond from CBC Hamilton. Desmond, you can go ahead.
Yes. My question is for Dr. Richardson, but I would like to, if possible, get a comment from the Mayor and Paul Johnson as well. After a year of COVID-19, what sticks out for you the most when you think about what we have been through?
Oh, Desmond, what a good question in terms of what sticks out the most. There's just been so much. And I think that's what sticks out the most is the extent of the impact of this pandemic across our community, the extent to which it has really changed our lives, whether it's, the ability to spend time with our families, or it's the impact that it's had on our elderly and the extent of impacts that it's had amongst our racialized communities, the degree to which we've had to change the way we do things, whether it's work, play, the impacts that it's had on mental health. I think it's just the range of impacts that it's had on nearly every aspect of our lives. And yet the stories of things that have come about that are positive, that are the kinds of changes, quite frankly, that need to happen and need to be made, and how this might actually accelerate some of those changes. And so as we look forward in this journey and into rebuilding, we must learn the lessons that we have learned and make the changes that need to be made as we go forward.
We're going to go in order. That's a brilliant question. I think we'll be spending the better part of a week, I think, reflecting on that as we, I don't know that we celebrate an anniversary, but we certainly acknowledge one. And in my mind, the adaptability of every part of our community to quickly change and look for other ways of either doing business or providing services has really stood out for me. I'm actually quite surprised at how adaptable this community has been. The individuals in it, whether it's city staff or the medical profession, or all the people in our community that have had to adapt to, a whole different lifestyle and a whole different way of, engaging in their community with masks on, physically separated. I mean, who'd have thought that if we asked people to do this, that they would understand and appreciate why and then actually go out and do it. And I would say the lion's share of our population, and we'll always find folks that are, idealistically opposed or ideologically opposed or have issues with some of the things that they've been asked or required to do. But, the vast majority of the population has understood what the need has been, has understood the risk, and has adapted and actually done it in a very agreeable way. I would have expected more, opposition and more disagreement, and I think that that hasn't occurred. And I think that's a real positive, and that's a real sign of a sense of caring in our community that allowed them to adapt to making the kinds of changes that would not only protect themselves but protect others in our community as well. So. A great question. We'll reflect on it some more. That's just one that jumps out at me right now. I'm sure Paul Johnson has a thought or two in that category as well.
So a couple of things. I think emotionally what sticks out for me is that, the depth of sadness, the depth of anger, the depth of inspiration over this past year, it's not something I've experienced in my 49 years of being on this earth. It's been a crisis and a pandemic that has drawn out emotions that are rarely sort of little bits. They are deep. And I think that's going to be part of the story of this. From where I sit, though, I am inspired by the way that the response to this has been sustained now for more than a year for some parts of our workforce and our community, but for coming up to a year from a broad standpoint in terms of declaring an emergency. I've been trained and working in emergency management. It falls under my portfolio on a day-to-day basis, and so I know what we can do in short bursts. But this community has never seen this long a sustained response. And even today, to crises that are emerging today, the calls that I've been on over the weekend, we continue to dig in, find solutions, and just work the issue. And I think after 12 months of this, that's something that's going to stand out to me, because we have not had to test ourselves in that. Short burst activities, we've seen that. These long pieces, we haven't really had the chance to learn from that. So that is that inspiration that I take away, that as tired as people are, as sad as people are, as frustrated as people are, they still step up. They say yes to every request that's made. They say, how can we help? And they bring forward solutions, recognizing that sometimes we can only look at what we have, and we just have to say, how can we use the resources we already have here and just do something that can help support people? And I know it hasn't been enough. And for some, this, the pandemic has taken a horrific toll on them personally, including some that have paid the ultimate price for it. But I do think in the midst of this, the story that I reflect on often as I think about this year that we're coming up to is just how we've been able to sustain really innovative and very positively responsive elements to various parts of this crisis.
And Desmond, if you'd like a follow-up, you can go ahead.
Yes, and thank you all for the great answers to that question. This one, I'd also like to hear from all three of you as well. I remember when I started working from home in March last year that I thought it would have been for 2 weeks. When did you realize that we'd be in this for the long haul?
I'll probably start off on this one too. I think, for me, in looking at what's happened with pandemics in the past, we have had pandemics before. We've had the 1918 one that is the longest reaching one. But we've actually had others in between, other influenza, swine flu that went through, and other things that have happened. And none of them have come to be as great as the one that happened back in 1918 until this one. And when we looked at it and what the impacts might be, I would say, realize this is probably a year plus in the making in terms of the response and developing vaccines and that sort of thing. So I think that was part of what was frankly quite hard, was that realizing this was going to be a longer term endeavor, and people were very much hoping that they would be turning around and going back to life much sooner than they would be. And you have to maintain hope, and you have to maintain the kinds of things that have supported the resiliency that you've just heard about from my colleagues in terms of going forward, but also realizing, that transition to helping people realize this was going to be a long haul and something we were going to have to do together was a really important part of the message that we need to get out and the response we need to create.
For me, and I think probably for all of us, a few weeks into, understanding that we had a virus that didn't have a vaccine was a kind of a telling moment that you kind of get a sense that this is going to be a long haul situation where, vaccines aren't created overnight. If we think back to historically to the days of polio and other vaccines that were created, it took years to have those vaccines developed and in place. to our good fortune, it hasn't taken years, but it's come on rather quickly. But it still meant that we were going to be in this for the long haul. The moment we realized that the vaccine for this had to be developed and had to be developed in a hurry, and in a hurry is a year. To get to this point, that I think is probably the fastest that's ever occurred in the history of mankind. And so now we're actually assessing not only how do we vaccinate, but what kind of time frame are we looking at in terms of recovery, economic recovery, and I think we're measuring that in years as well. Because you don't just flip a switch and everything gets back to normal. The businesses that have been harmed or have disappeared, as a result of this pandemic, don't return overnight. Our transit system doesn't, ramp up overnight either. It may take multi-years for that to occur. So I think there's a realization now as well that the economic recovery is also a multi-year process that we're going to have to work with our federal and provincial partners collectively on restoring our economy to a state of, either pre-pandemic, with hopefully some changes as a result of the learnings that we've had throughout this pandemic in terms of marginalized and challenged communities that have been more heavily impacted, and how do we address that going forward to make sure that we prevent that kind of thing from happening in the future.
So certainly concur with the mayor and Dr. Richardson, but I would add another piece. So yeah, early on, as you learn more, you start to realize this is something that's going to take some time. But for me, it was when second wave began in the fall. There had been a bit of this thinking as we went through a summer. We had days, Dr. Richardson would say, no new cases today. And we had very few outbreaks, and our shelter system had weathered 6 months of the storm, and we didn't have outbreaks in shelters, and we were seeming to get a bit of a handle. And then second wave came. And I think that was the moment for me that it wasn't, though I realize now we were in for the long haul, because I think I probably realized it earlier, but I realized we were in a long haul of some pretty significant restrictions on our communities. And up until that point, we had been talking about whether staff would come back to offices, holus bolus, and in the fall. We had been talking about whether things would start up around the holidays or into the new year, much more of an activity-based thing, whether you were looking at sports or other school activities. And I think it was for me when that second wave caught hold, we saw just how powerful that second wave was as we worked through the fall, that now you began to think in terms of a full year's time until we're really looking at loosening some of those restrictions, and then to the mayor's point about how much longer this is going to take for us to transition out of it. So I do know that there was, for me, in that early part of that second wave, that moment of, stop thinking about the next couple of months, we're going to get back to a less restrictive role, start thinking about this is going to be much longer.
Great, thank you, everybody. Next question, we're going to go to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi there. I wanted to ask Dr. Richardson. So there's been some concerns about some congregate living facilities that for seniors that still haven't received vaccines, such as the court at Rushdale. And according to the provincial plan, it seems that residents of congregate care are in the first phase. So I was wondering if you can comment on how public health defines eligible congregate living facilities and when residents in places like the court at Rushdale can expect to receive them.
Thanks very much, Maria. In terms of congregate settings, it's actually a definition that's set by the province, and they have established that it's essentially a place where there is shared dining, where there is shared time that is spent together. So if people are living in, for example, a seniors apartment building where they may choose to spend some time together, if, for example, if they have a lounge or that sort of thing, that's not the sort of thing that makes it for a congregate setting. And so we've actually had 2 sets of reviews over with the province about what is considered those congregate settings with long-term care homes and retirement homes. And you'll have noted that at one point we did actually add another retirement home, for example, to our high risk group because of the reviews that we've done with them on those. That said, we know there are several settings where there are people who are living together that may not just be seniors, they may be others. There are developmental types of living arrangements. There are many other settings that belong to that congregate group as well. And so are mindful about them, because it is those kinds of settings where people are getting together for things where the risk of transmission is highest. So I hope that helps you understand sort of which of the congregate settings for seniors in terms of settings that where there may be more seniors that are living, like seniors apartment buildings or retirement communities. That is something where we might be looking at it from the standpoint of how can people access the vaccine, but it's not one of the official congregate settings.
Thank you. So if I understand you correctly, does that mean that those people living in those settings should, like their option is to essentially phone in like other residents in the community once it's time for their age group?
Thanks, Maria. Yes, so for these, especially once the portal gets up and running on Monday, that is a great time for them to go ahead and register. Of course, we'll be going with 80 plus as of March the 15th, and then working down through the age groups.
Great, thank you, Dr. Richardson. Our next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions, and congratulations to Dr. Richardson on the award and the recognition. I was hoping, Dr. Richardson, you could talk a bit more about these allegations with the mobile clinic. Like, what exactly are they accused of doing? Like, were they selling these vaccines? Were they giving them to friends and family? Did they give them to just people who showed up? Like, can you give us an idea of, first of all, where this happened? And second of all, like, what exactly is alleged to have happened?
Hi, Joanna. Thanks so much for the congratulations. I really appreciate that. As you know, whenever it comes to investigation of this sort of thing, when somebody makes a complaint around something that has happened, that is all part of the process. You know exactly what you're talking about in terms of understanding what is it that the complainant saw or experienced that led them to make a complaint, and then working through with those that are there and looking at any systems in terms of what it is that we can understand about it. So that investigation is very much actively underway. It will take us a little bit of time to complete. It is something that we want to be very clear in terms of what we understand has happened before, of course, we make any comment on it. And so, answering any of those questions at this point in time would not be appropriate.
And my second question is also to Dr. Richardson. The science table put out a brief today that showed only about 55% of long-term care staff have had a first dose, that the uptake has, been a bit low in among staff in long-term care. Can you talk a bit about what that uptake has been in Hamilton?
Yeah, that's something very concerning that we saw from the science table. And as you know, we've been talking about the vaccine and the benefits of the vaccine, and are very hopeful that people will be taking it up in good numbers. And so one of the things we did, because of the challenges of we don't have the systems in Ontario for us to know exactly who is employed where, and then to have a vaccination system that has all the documentation within it and whatnot. Unfortunately, that's the state of the system here in Ontario. So in Hamilton, what we have done is actually done a census with those homes to find out exactly who is vaccinated and who may not be so far, and so that we can have those numbers. So we're hoping all of that information will be back and analyzed and out to you later on in the next week or so. In the meantime, we're very much continuing to encourage people to become vaccinated. So for the staff that are in long-term care homes, we've now completed the vaccination of both of the residents that we were doing in the long-term care homes, but they remain eligible to be vaccinated through the vaccination clinic at Hamilton Health Sciences. And as well, if we're back and doing any vaccinations for anybody who is catching up still, who is a resident who is there, we can vaccinate them when they're there as well. So we're actually hoping very much that those numbers will continue to rise over the coming days, but we'll have a good sense of where we're at with our one-day count that we did.
Thanks, Dr. Richardson. Our next question will be to Don Mitchell from CHML. Don, you can go ahead. Okay, we'll just get you off mute there, Don.
Sorry about that. Just working on it. I kept clicking my mouse, but it wasn't happening. Anyways, congratulations to Dr. Richardson. And my question is simply, I saw some data today from the province of Ontario in terms of vaccinations per capita. Apparently, Hamilton is way ahead of a lot of regions across the province, including like Halton is only at 33, I think. And I think it was something like just over 11,000 in Niagara region, that sort of thing. I wonder if I can get a comment on, I don't know if it's necessarily from just Dr. Richardson or whether it's from Paul Johnson. What do you think you attribute that to? And have you heard that?
Hi, Don. Thanks very much for the congratulations. In terms of that information, I haven't seen that yet. I mean, it's been something that we've been curious about in terms of getting data from the COVAX system that is being used for vaccination monitoring. We know that the system's still working out some kinks in terms of what's where and what's not, but we'll take the good news where it comes in terms of what you're sharing here today. I know, I mean, despite the frustrations that people have had in terms of registering and getting booked in for the vaccine, that's been our bottleneck. The booking piece has been our bottleneck in moving forward. But we have had tremendous support from the hospitals, from primary care, from across all of the system in terms of moving this forward and getting the vaccine out. So we're very much looking forward to the opening up of the provincial portals so we can get booking moving even faster than we have right now. But I'll be curious to go and take a look at those now, Don. Thanks for giving me the heads up.
And Don, did you want to ask a follow-up question?
Yeah, sorry about that. And I guess I'll pass on the question I was actually going to ask. I was going to ask if that was going to change your assessment of when potentially everybody could get a vaccine. But what I'll ask instead is actually Hamilton Health Sciences said they were assessing potentially putting up a pandemic response structure. I believe it on Wellington Street. Do you know if public health has heard anything about that?
Thanks very much, Don. I'll say that we have heard about it. This is something that they're working on in conjunction with other levels of government, but it's primarily done at that level. Paul, I don't know if you want to add anything.
I think it's fair to say at this point it's still being discussed as to exactly how that would roll out. So it's not going to be implemented imminently, and exactly its role within the community. I think Hamilton Health Sciences, I know, is still continuing to look at what role that would play in our response as a community. So I think the discussions are ongoing. Don't expect to see anything, erected in the next couple of days. This is still a ways away, as the latest information we had heard from Hamilton Health Sciences. And I just wanted to chime in on your earlier question, Don, as well, and say, I'm connected into a lot of the community-based organizations, and I will say that on the vaccine front, our public health unit, supported by all of their partners, has done a tremendous job of helping people to get ready. And one of the, I don't know that it's the only factor, but I know one of the factors that is really working in our favor is public health is helping people to understand what will be required when the day comes for vaccine to start. And one of those examples is our shelter system. The fact that we could, on a 12-hour turnaround, get our shelter system ready to accept some vaccines is about readiness. And so I do want to commend our folks for the work that they do in helping people to prepare. Sometimes that is prepare for several weeks ahead because we're not exactly sure when the date is. But their preparation is going very well, and that allows, I think, public health and the hospitals to execute quickly when they do get the vaccine supply or the green light from the province in the case of the shelters to actually go and start that vaccination. We don't then have to begin the conversation about what that looks like. We're ready to go ahead and start the operation. So well done to our folks, and I think that's made a difference.
Great, thank you, Paul. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
All right, thank you very much, and thank you to the media for your questions. And I would reiterate that a state of readiness has been the order of the day in terms of all of the public health work that's been done, notwithstanding that, some folks don't believe that we're prepared or ready. We absolutely are, and as soon as supply is available, it will go into the arms of individuals that are registered to get them in the prescribed way that the province has laid out. So We are all looking forward to the online booking system that the province has promised to get up and running, phone and online, actually. And so our temporary phone line system did get overwhelmed by many calls, but it was really to fill a gap in the system so that we can get vaccines into individuals' arms sooner rather than waiting for the March 15th start date for the province. So thank you for all of your patience out there, and we'll continue to work to make sure that we get vaccines into arms as quickly and as smoothly as possible. And we want to thank our team here at Cable 14 and Bill Custers and Clear Cable for making these media advisories as smooth and painless as possible. And those media partners are here each and every week for us to make sure that we get this work done and share this information with you. And we really appreciate your effort to make it good. And of course, the vaccine and the financial supports and any updates that you're looking for in terms of impacts are on our website. So best source of information for anyone that wants to know the vaccine, the pop-up clinics, the resources that are out there for you in terms of offsets for your business or individuals is on the hamilton.ca/coronavirus website. That is accurate, up-to-date information that will tell you exactly where our state of readiness and where our clinics are going to be or are, in fact, ready to be set up as soon as the supply is available to us. On that note, we will see you next Monday, March the 15th, a couple of days before St. Patrick's Day at 3 p.m. And we want you to continue to take care of one another. And thank you for the ongoing work that you're doing, looking after each other, staying kind and being patient. That patience will get us a long way to getting our vast population vaccinated and getting back to some sense of normalcy as soon as we can. Thank you all very much, and we'll see you next Monday.
All I want to do is hug my children. All I want to do is squeeze and kiss my grandchildren's whole face. That's what I want to do. So help me and do the right thing.
We're all in this together, Hamilton.
We're all in this together. Stay home, stay safe.
Do your part. Wear a mask. Have good hygiene. And we'll get through this together.
I care about my staff. I care about my residents, our 2 City of Long-Term Care homes, and my family.
We stand together, and it starts with you.
Do this for the children.
We're all in this together, Hamilton.
Be strong.
The future needs us to do the right thing.
It's all about kindness.
Be patient. We're going to get through it as a community. We just have to do it together.
Together, we really can build a healthier and more resilient Hamilton.
The public health measures are for everyone.
We're all in this together, Hamilton.
And together we will do this.
So they took me by wheelchair into my mom's room. I held her hand. I told her I loved her. And I told her it was okay for her to go.